We should start as soon as possible.
Talks about a mental health crisis response system ongoing today in Sacramento County.
We're trying to both have that sense of urgency to do what we believe is the right thing to do to provide better service, but at the same time, ensure that we're very thoughtful about what the structure of that new system will look like.
This would include a special team to handle mental health crises 24/7 and take that job off of police.
Shifting this away from the responsibility of law enforcement to those that are best equipped and trained in mental health treatment and crisis response should be the ones responding.
Calling today to request that the Board of Supervisors vote to support
a move that many agree should be handled by other professionals.
We believe that mental health professionals should be the ones handling mental health crisis. And for a very long time, law enforcement has really been criminalizing mental health issues.
If someone is having a psychotic episode or a manic episode, they're going to have a lot of energy. They're going to be very talkative. They're not going to be in touch with reality. And so they do need a softer, gentler approach.
While experts say this would help in de-escalating aggressive or violent behavior,
showing interest, curiosity, having a warm, open, compassionate approach, certainly not authoritative or confrontative as most police have, is a good way to de-escalate the situation.
The Board of Supervisors is still looking into what that responsibility shift would look like. The county has yet to determine if a separate call center would be needed, a different number from 911, and how much money that would cost. The board will be meeting back in June when they hope they'll have a better idea of what the budget for this program will be. In Sacramento, Marisela de la Cruz, KCRA 3.